in the subject, the specialty that you are doing your postgraduate. And then next, it influences our medical practice. If we have done the thesis, we know what is data, what is evidence, then our medical practice, we try to keep it scientific, on scientific basis. Otherwise, over a period of few years, our medical practice will also become unscientific. So thesis is like the pillar which has kept the evidence-based medicine alive, and also it is ongoing. So the first thing is the research question. So how to decide a research question? Research question is any problem that we find in our clinical practice or some policy or some guideline related issue. So what happens is that we try to formulate it as a research question, and the framing of research question has to be done in the form of PICO. Now this short PICO will we will carry it across the whole presentation also. So P stands for participants, I stands for intervention / exposure, I'll tell you why, and then C control / comparator group, and O stands for outcome. These are the four things that must be there in the research question. So if you find any problem, if you're looking at a patient, you're giving some management, but you see the patient is not getting, the outcome is not as per what you're desiring, or you are giving some other intervention, that outcome is very good. You want to compare something like whether this is better or that is better. Now, this is the problem that you have identified, that this particular treatment doesn't seem to work, or that is better than this. And you want to do a focused research on that. How to frame it? So you will have to write the participants, intervention, control, and outcome. Now, exposure is for intervention. We write when we are doing an interventional study. I'm not going into the details of study designs right now, but intervention is for interventional study. And when we have an observational study like case control or cohort study, then we are comparing. When we are comparing the exposures and the outcomes, we are not intervening directly. Then we are calling it as exposure here instead of intervention. I am giving you an example here. Now look at the title. Now this I have taken from journal and A.K. Jain sir's article. There are other authors also I have seen. So this is from that. So there are three titles or research question written here. This is actually a title, but it will give you an idea about how a research question is framed. So in this particular three titles, if you look at it, can you identify participants, intervention, control, and comparator and outcome group? So if you look at the first example is outcome of core decompression with or without non-vascularized fibular grafting in avascular necrosis of femoral head, a short-term follow-up study. If you look at this, the intervention is core decompression with non-vascularized fibular grafting. So that is the intervention. And control is those without non-vascularized fibular grafting. And the participants are those who are having avascular necrosis of femoral head. And the outcomes, it is mentioned the outcomes. So here it is mentioned outcomes. So we are seeing that when we do core decompression with a particular technique, or we do use another technique for this condition, patient suffering with this condition, avascular necrosis of femoral head. So this completes the thing, the whole thing. If you have all these things, then you can say that your research question. The only difference is that as we move ahead from title to research question, we have to put it in the question form. That is not kept here. So we will have to further modify it and mention it like what are the outcomes of core decompression with or without non-vascularized fibular grafting in avascular necrosis of femoral head ? Now, second example, if you see tubercular spondylitis in children. Now, this particular thing that you are seeing, sentence that you are seeing, can you identify participants? Can you identify intervention? Can you identify comparator group? Can you identify the outcome? So it is difficult. We are not identifying these things. What we are identifying is only the participants, that is children, and we are identifying the outcome, that is tubercular spondylitis. So this is actually, this also is correct. Why this is correct? Because this is a observational study, a cross-sectional study. We just want to find out in children what is the prevalence maybe of tubercular spondylitis, how many children are suffering from tubercular spondylitis. So in an observational study, when it is not a comparative study, you can have only P and O, that is participants and outcome, not the whole PICO. I and C will come when intervention is there and when a comparator group is there. Okay. Let us look at a third example, treatment of neglected femoral neck fracture. Now in this also seems to be an observational study, a cross-sectional kind of study, or a follow-up study, but in this there is no comparison group. So let us see what are the participants. Participants are those who are suffering from a neglected femoral neck fracture. And what is the outcome? The treatment. So some treatment is being given and the treatment is the outcome. So you will find that there are certain observational studies, there are certain comparative studies, there are certain cross-sectional studies. Depending upon the objectives of your study, your research question actually will be having, if you are comparing, then it will have a comparator. If you are not comparing, you will not have a comparator. If you are intervening, you will have an intervention. So either you will have PICO or you will have P and O. Again, this particular sentence must be modified in the form of a question, like what is the prevalence of tubercular spondylitis among children? That will become your research question. So here I have just squeezed the sentence. I have not written the full sentence so that not to clutter this particular slide. But this is the idea behind this. So I hope you will be able to frame this research question or check a research question when you see one by using the PICO technique. Second is you have to write an introduction of your thesis. Now, what does that introduction consist of, section consist of? So the introduction section is basically written to tell the reader why was this study conducted, because the reader does not know may know what are you doing, but without a why you did a study, nobody is interested. So first we have to convince that why this study is important, why this solving this question is important. And for that, what we do is first we write in the introduction what is already known on that particular topic. And then we write what is not known in that topic, what is the lacuna, focusing on what we are doing in our study. And we have to keep the introduction very focused. Why I say focused is because we have seen the introductions where it starts, suppose that there's a tubercular spondylitis in children. Now, some thesis might start the introduction with that tuberculosis is a very ancient disease. We see the references of tuberculosis in various scriptures and various old texts. And then tuberculosis, may first time the diagnosis was this, and then how the treatment evolved. And at the last paragraph or the last page, it will be written about the thing that you are doing in the study related to that. So it is important that you keep your introduction short, crisp, and focused on the research question that you are intending to solve in your thesis. Now, this is an example of an introduction. I've just put one slide. In thesis, you have around 2-3 pages of introduction. That thesis you have a liberty to write, but then also it should be focused. It should not be very detailed. Yeah, I'm just showing you that how you can understand about introduction. So if you look again, it is from the same paper that I have started with. That was this, but outcomes of core decompression with or without non-vascularized fibular grafting in avascular necrosis of femoral head, a short-term follow-up study. So if you look here, you will find that the first sentence is just about that avascular necrosis occurs in 3rd to 5th decade. So this is an age group that is important and you are focusing on that because your study is actually focusing on that age group. So you want to write that this is a common problem in this age group. So this is something why your study is important, what is already known. This is how you are building up your case for the research question. So first sentence you wrote this. Second, you wrote what is known about these treatment options. So in the second sentence, so this is basically I've written a sentence, but in your thesis it will run in where you will write other things, references, and other details also of these things. This is just a summary. I'm on the stage of disease varies from this non-operative to operative procedures, and which will depend upon various things. Then the lacuna. And in this, if you see, the highlighted part is finite life of the total hip arthroplasty prosthesis limits its use in young adults or middle-aged. Now, because a particular intervention is limited in its use in a particular age group, therefore, you have written the final sentence of your introduction that becomes the aim of your study. That because of that, this study actually is envisaging to evaluate the outcomes of core decompression and non-vascularized fibular grafting in early stages of avian femoral head. So this is how introduction is built up actually. So you build a convincing this particular thesis. It should not carry other details about total hip arthroplasty के बारे में detail. If you write, then it becomes a problem and it's not useful. On to after introduction, we move on to the aim. And when we write the aim in the thesis, it is what the tend to achieve. That is the aim. It's a broad aim. I will tell you how I say it's a broad aim and how we make it narrow and why we should make it narrow also later on. So in aim, if you see aim, where we ended our introduction, or you can write separate aim in your thesis. You write a separate page and you write aim and objectives. So in that you will write. So here it is written. I'm giving an example that to evaluate the radiological outcomes of core decompression and non-vascularized grafting in early stages of avian femoral head. Now this is the aim. This is broad, and when you will see the other step, then you will understand why I'm saying that this is broad. Because it has to be converted into objectives. Just by writing an aim, we will methodology and doing our study and writing our results. Aim will not help in that, but yes, aim gives the direction in which direction we are going. So let us see where does aim lead us to. Aim leads us to objectives, and objectives have these SMART criteria: specific, measurable, achievable, relevant, time bound. Mainly the main criteria is measurable and feasibility. Whether you'll be able to do it or not, time, whether it is important or not, and whether you can measure it or not. Something you are saying that you want to measure, in objective, you have to decide how will you measure it, whether you'll be able to measure it or not. If you are able to measure it, then you can do that study. So from aim, we have two tips by using something measurable outcome. Let us see how we can convert that aim into the objectives. So if you see the first sentence, to evaluate the clinico-radiological outcomes of core decompression and this early stages of this, right? Now this was the aim. When we convert it into objective, we have a primary objective and we have secondary objectives. Primary objective should be only one. Keep one primary objective and you want to keep as many secondary objectives as you can, 5, 10, in certain it runs to 52 secondary objectives. That's the maximum that I have seen till now. But in thesis, around 4 to 10 secondary objectives we see. Primary objective, one primary objective, because this primary objective will determine your sample size calculation later on, and also the various other things that we're going to discuss regarding methodology and all. You will have to focus more on the primary objective. This is your studies or primary objective. And secondary objectives, you can write as many as you want. Objective, if you are converting this into primary objective, I have converted it here. So primary objective of the study is to compare the pre-op this Harris score in those who underwent core decompression and those who underwent both this core decompression and fibular grafting. So this is the primary objective of the study. Now you see, can appreciate the difference between the aim, that is the top sentence. Top sentence does not mention the outcome measure core decompression. So when you convert it into objective, you are converting that unmeasurable thing into measurable entity. And when you write pre-objective, this PHHS score, then this is a valid score which is used to measure this. So, and you want to compare this score between the two. You are comparing these scores in the two groups. This is your primary objective. Secondary objective is this RSIP score. It is some other score like VAS, actually visual analog scale it was. I think I did not change it. I'm sorry for that. So it is to compare the visual analog score in those who underwent the one particular intervention and compared to those who did not undergo that particular intervention. And then you can compare the radiological outcomes also. You can compare some other clinical outcomes also in secondary objectives. You can do all that. So I hope you understood the difference between aim and objectives in this. So objectives must have outcome measures. Then we come to the methodology part. In the methodology part, basically, if you see, it starts with type of study, right? That this is a cross-sectional study or interventional study, case control, follow-up type of study will be written. The setting of the study will be written, that it's a hospital-based study. Where did you do the study? In operation theater-based study. Depending upon the thing, you will write setting of the study, rural area, urban area. You can write all these things. Then, if you see, again, we follow the peak pattern. In methodology also, we follow the peak pattern. So first we write about participants. So who will be the participants? Inclusion criteria, exclusion criteria, and then sample size and sampling technique. Let us see the inclusion criteria and exclusion criteria first. Usually we see that people writing about inclusion criteria, and we see that it is written that 50 to 40 years of age group will be included. That's fine. Then in exclusion criteria, we see less than 15 and more than 40 will be excluded. Now, this is a wrong practice. Why? Because once you have included, out of those whom you have included, exclude from that only. So if you are including 14 or 15 to 40 year age group people, then after including that, then you will exclude from that. So some people who are suffering from certain condition or some other seriously sick patients or something like that, if you're excluding from that, then you are doing your final enrollment. Inclusion criteria not mean this we are including in the study completely, because after inclusion criteria, you have to apply the exclusion criteria also. And then it will be the final enrollment will be done after both the criteria have one after the another. Inclusion criteria, exclusion criteria, sample size and sampling technique in participants. In participants, we write about sample size and sampling technique. Now, sample size, we should calculate sample size based upon our primary objective. In this case, if you see, the primary objective was comparing these scores, and for that, you can use softwares, you can consult a statistician, or you can use some formula, and then you can calculate sample size. For sample size, you will require some earlier published studies that are there, and based on that, you can compute your sample size. Often we see students saying that in another study, 30 or 40 or 50 subjects were taken. So we also will do that based on that study. That is not the sample size calculation is done based upon what statistical technique you have to use. If you are comparing mean scores of this, you consider this study only, operative Harris hip score. If you want to compare in these groups, you should have an estimate about what will be this score in this group and that group based upon the results of some other studies which have been done on the same particular topic. The chance you don't have any study that has been done on that topic, before going for sample size calculation in the thesis, it is always better that we do some pilot study, like we collect maybe 5 or 10 patients, write the scores, and then by the other technique, write the scores and use that estimate for the sample size calculation. Or you can get from the hospital records also regarding some type of intervention. Then you can use that also. So either prior studies or do some pilots or use the data from hospital records if it is available. Randomized or whether it is non-randomized. Often we also see that students write randomization. We ask how did you randomize? Then they say ki as were coming, we were rolling the patients. So that is randomization, can come anytime. That is not the right way. Randomization right when technique formation. Otherwise, all the other things are randomized. For example, you are using some other technique, you are drawing chits or draw of lots, we say, then we can say that it is randomization. So this is a broad thing. There are many nuances to the things that we're talking today, but let us have an overview today, and maybe some time later we can have some detailed presentations on each and every aspect of it. Then next we write the intervention. And when we write the intervention, I said PICO. So P participants, the detail of the participants, then intervention that you are going to give. So if a particular type of surgery is there, or if a particular type of nail plating is there in orthopedics. So whatever intervention, particular type of drug is being, it has to be given in detail in the intervention section. And then the comparison section also, or the control group also, that you will have to controls given, how they will be administered, what will be administered in detail. All the definitions that are being used, like in this particular case, if we see scores, preoperative Harris score, what is the definition of this? That also has to be mentioned in this, and that will come in the outcome part. How did you measure the outcome? Is it a valid measure? That has to be written in the outcome part. If you're using some case record form, some questionnaire, you will have to give a detail about that also, how you are collecting the data, whether it is interview technique or whether it is a self-administered questionnaire. So that you will have to verify in the outcomes part. So these are the various things that are included in methodology. Basically, PICO format is to be followed. All definitions should be given in detail. Nothing should be left to imagination. And you can give also, if you are using certain standard treatment, for example, for tuberculosis, the National Tuberculosis Control Program related guidelines were used. So then it is okay. But for primary objective, you have to give all details as much as possible in the methodology section, because it gives all the details of the various things. That is comparatively a good size document it becomes, and some references also we see in the methodology section. Now this is an example again from the same article that I'm referencing. So this is, if you look at this particular methodology, for the first highlighter is that study design is written, then the patient's age groups are written. This because I have already taken from a published paper, and that 76 this and the age group of this were. But when we will write in the thesis, then we'll say how much sample size we are. Then if you see included and excluded, so inclusion criteria, exclusion criteria is written, and then we move ahead to that stage 1 underwent this and stage 2 underwent this. So what the intervention was, and then the outcome, it is written. So this is a summary what we're showing. I've taken it from the abstract. But if you look at the detail, each and everything is given in full detail methodology section. So after the methodology section you have written, then you go on to data analysis. Now data analysis consists of these points, mainly how was the data recorded, how was it compiled, what statistical software were used for analysis, what are the key variables, categorical variables or continuous. Categorical are basically those which are in categories like gender, male, female. It's a category. Continuous is like age, blood pressure, systolic blood pressure, or like force. All these are continuous. Then you'll have to write in data analysis that the age will be presented as means or something. Force will be presented as means. Categorical variables such as age will be presented as proportions. These all things you will have to write. And then lastly, you will have to write what statistical tests will you use for comparisons in this particular thesis. T-test, chi-square test, some regression technique, correlation, whatever you intend to use must be written in the data analysis part of your thesis. And lastly, we just mentioned p-value cutoff. It's a default value point. So that's a default value. We don't change it much unless and until there is some strong reason for that. So example I've just given, that data was entered in Microsoft Excel spreadsheet. If you're using this, if you're using some other software, you can write that. In SPSS version, this was used, or you are using some other statistical software, you can write that. Then categorical variable. Often see students just writing that the variables will be presented in the appropriate manner and appropriate statistical technique will be used. And that is where the statistical analysis section ends. But that's not the correct method. The correct method is you will have to, what are the categorical variables, what are the continuous variables, what are the statistical tests that will be used. And then you write that final line, p-value less than 0.05. That's the standard line mostly in most of the research. After the data analysis section, we move on to the result section. Result section is a very we say bland section, like इसमें कोई interest ज़्यादा इस तरीके से नहीं आता, उसमें कहानी नहीं होती. It's not a story that you are telling. You are just telling what you have found. So if your objective is to compare a particular score in the two groups, you will just write that in this we found that the score in this group was this, the score in the other group was this. Now we have like primary objectives we have written. So all the objectives that we have mentioned in the thesis in the beginning, all those objectives, the results related to all those objectives must be mentioned in the thesis. It should not happen that there are 8 objectives or 7 objectives and you are writing results related to only 5 of them. No. And this should also not happen that you are writing 7 objectives, but you are writing results about some other objectives also. If you want to do some other analysis and write some other thing, you can mention separately in your result section that these are the add-on analysis being done and add-on findings in addition to the objectives. That has to be separately mentioned. Next, we start our result with baseline characteristics, like what was the population and what was the maybe social, maybe the type of accident that the patient underwent, or maybe some other from your objective point of view. You write the baseline characteristics. Then you move on to the descriptive tables. You just show the descriptive tables, like what was the mean, what was the portion of the various categories or the various variables like age, sex. Yes, I'm sorry. I think this internet got disconnected somewhere in between.
Yeah, almost.
So I will have to again share the screen. And yes, and Also, so where did this disconnect? I think, yes. Yes, so I was here. So descriptive tables, and then so basically it will be the some description of the various variables that you have analyzed, and then you go on to the analysis table. In Thesis, we follow this pattern. First, we write the descriptive table, the proportions, the means of the various variables that have been measured, and then we go to write the analysis. Analysis is like statistical tests and all that we write in separate tables.
Not seeing your slides at the moment.
I'm able to see, sir. Maybe your voice is also.
Okay,
yes, sir.
My side.
Yes,
okay,
sir.
I have to just reconnect.
Yes,
Fine,
yes.
carry on.
So this analysis related tables basically are the statistical analysis related tables that we show later on. And then the complex analysis like regression and all these things, survival analysis, curves and all. So some complex analysis we present at the end. We don't write these things at the beginning. Like we start the results and first we write regression. We did the regression and we found that. It always starts with baseline characteristics. Then we go on to write the descriptive tables. Then we go to a statistical analysis related tables, and then the complex statistical analysis at the last. And I'm just putting it here because it's a common problem, p equal to 0.000. Now the statistical software gives us as such, and many times you see in results it is written like this. It should be written as p less than 0.001 because p equal to 0 means nothing actually. And lastly, we should avoid the urge to explain why we found this result. Suppose we found that in one particular group that our intervention group results are better, and another group the results are poor. Then we might like to write because it was a good technique. It was found that in this blood loss was also less. It was found the time taken for surgery. That is why we are finding good results or something. We should not write any explanation about any finding in the result section. This is difficult to avoid, but it is very important. If you have that urge, you want to write, you write it down, but later on copy paste that component in the next section that is called as the discussion section. We will come to that a bit later. First, let us see the example of result section now. Now, result section basically consists of two parts. Basically consists of two parts. There can be three parts also. One is the text section, like I'm showing it here from the same paper abstract. Then you will be having the second is a tabular section, that is table 1, table 2 and all those. And then you might have the figures, you might not have the figures. Now let us see the how it progresses. So first is the basic description about follow-up and then radiological progression in this. So some baseline characteristics are given. And then you move on to the later part and you write median values of this score at the end of the follow-up. In group 1 was itna, and then in another it was this much. So you write the findings of your, and then later on you can write, I'm not showing the whole thing, but later on you will write the statistical analysis part that this was significant and all those things. Now table and graphs basically, the criteria is that if somebody is looking at the table, just the table, somebody has not seen the whole thesis or anything of the thesis, just looking at a table, the reader should be able to understand the thing completely. Now, when I say that, the title of the table should be clearly explaining all the things that are mentioned in that table. It should not be just mentioned that this table compares group 1 and group 2. No, it has to mention that this is showing a comparison between the VAS scores, if there is a visual analog scores, of patients aged 15 to so many years, 40 or 50 years, and those who were operated by this technique and operated by another technique. So all these things have to be mentioned in the title. Then if you look at the table formation will be like this. There are rows, horizontal rows and vertical columns. So in the first row will consist of the column heading, the headings of the columns. And in the first column, you will have the rows. So all the cells of the column, first column, it will be the various variables like age, gender, some other visual analog score, or some other thing. You will write the certain things in the table, and then you will write the corresponding proportions or means or medians in the groups, and then you will write the p-value. What is the p? You write the exact p-value, maybe 0.018 or maybe 0.53, whatever you get, you will write the exact p-value. And if there are certain abbreviations used in the table, then you will have to write it in the footnote. Sometimes we also have to write in the footnote certain things, how they have been measured. For example, if we write socioeconomic scale, we write that in footnote, we put an asterisk mark around the socioeconomic scale, and we write here that based on income criteria or Kupuswamy scale or some other scale, we write that. If some p-values, they are significant, we write, we put a hash or a star mark and asterisk mark, and then we write below that, that means that these p-values are significant. So it makes it easy for the reader to focus on certain things that you want the reader to focus, and you are presenting all the details in the table. Similarly, if you want to make a graph also, then the graph also should be sufficient to stand on its own. Like people should not have to struggle that by seeing a table or a graph that I don't understand what is here, what is the number of the patients in this group or that group. All the things must be mentioned in the table. After results, you will move on to the discussion section. And here you will discuss the findings which you have got. So you will discuss all the findings as per the objectives. Again, the order of writing the results should be again followed in the order in which you will write the discussion. So if you have written a baseline characteristics first, then you discuss the baseline characteristic first. Then you have written some descriptive analysis tables, then you discuss that finding. Then you have written some analytical tables, comparison by statistical test, what you found, again explain that. And then the complex analysis part 1 you will explain. So discussion will follow the objectives, the pattern, the flow of the this objective, and also the flow of the result section. Any finding that is there in the result section must be discussed. Anything that we have not found in our results, it should not be discussed. Just because we think it is important, it is related to the topic, we can't put it in discussion. So the better it is aligned with the results, the better is the discussion. Now, what will you write in the discussion section? A discussion section will have, first you will compare with the earlier published study findings, which are similar studies. You will try to find out, and then you will compare the results. And if they differ, the results are different, then you need to discuss about why they are different. If they are similar, you can also point out why they are similar. Then secondly, you can also hypothesize. This is a free space actually. Discussion gives you some freedom. Till now you have to write according to protocol, but discussion you can write some things on your own. If you're finding some result and you think that because it was done in patients which were maybe suffering in our group, these patients were belonging to lower socioeconomic status, and that is why we might have got this result, or the proportion of the diabetics were more in this group, that is why we might have been found this, or there was more of obesity, that is why we get results. So we have the freedom to write about what you hypothesize, what you think, why you have got those results. You may not be able to justify with some other studies. If you are able to do that, well and good, do that. Otherwise, you can write on your own also. Nobody stops you there, but it should be logical, whatever explanation you are writing. Then it is good if you can link your results, findings to the guidelines, treatment guidelines. That as what we see, it supports a particular policy, supports a particular guideline, or it goes against a particular guideline. So we need to think about. So if you can relate to practice, to your clinical practice, to the treatment guidelines, or to certain health policy or policy, then it is better. Discussion section, you can do that. Then we avoid giving numbers in the discussion. We don't again repeat the p-values and all the mean, median, everything. We don't write in the discussion section again. We just write that this was higher, score was higher in this group than in that group, and then we start discussing that. So these are some of the points in the discussion section. And then we write the conclusion. And when we write the conclusion, we just mention in text, not numbers. Again, we don't use the numbers like mean, median, proportion, and statistical test finding here. We just write in text, what did you find? And remember that conclusion is the first thing. After the title and objectives, whenever we want to see which paper I want to read related to a particular topic, what we do is we first read the title, then we read the objectives, and then we directly go and see what is the conclusion. So conclusion should tell about what is the crux, what is the primary objective related finding you have got in your study, because your primary objective is the heart of your study, and your conclusion should reflect upon it is like the answer to the research question that you started with. In the first slide, we showed research question, and in the end slide, we are showing conclusion. So you can think that conclusion is the answer to your research question. So we don't write in conclusion or those points which you have not studied. We can't write like this in this study, it was very costly or very resource intensive. Many people will not be able to do this treatment. That was not the objective of your study. So you cannot write those things even in your discussion, in your conclusion. You can't discuss or conclude with something that was not in the objective of your study. So this is an example of the study that I started with by that example. And so this just mentions that core decompression with or without this grafting is effective in preserving this sphericity of femoral head and to delay the progression of AVN of femoral head in early stages and aids in the early revascularization and is a useful modality to negate or delay the requirement of THA. So this actually sums up actually what the study has found out. And if somebody is interested, they can read the details of it. And if somebody thinks that, no, this is not what they are interested in, they're interested in maybe radiological finding or some clinical finding, then they can go and read some other paper. So title, your research question, which changes to your aim actually. And then your conclusion is the answer to the research question or the aim that you started with. Citation and references, we'll need to have another session on that detail, but as per the ICMG criteria, we write the references basically, and you can use softwares also, but I will say that even when you use softwares, we find that students use softwares and then they submit it directly to the committees, thesis committee or protocol committee. And then we find that there are mistakes also. What software does is it will extract the data provided by the publishers on the website. That is what the software pulls. But sometimes there are the journal name is written in capital letter. Now the software will pull it like that and put it in the references. So you can use Mendeley software, Zotero software, and Note, various softwares for writing, but it is advisable and highly recommended actually that after you have written the references, you check it manually whether it is as per the Vancouver criteria, what we say. Now it is called the ICMG criteria. So you can check as per that first you have to write the names of the authors, then you have to write the title of the article that you are referencing, then you have to write further the year, and then you have to further write the volume, issue, and then page numbers. All these things have to be written in the and if you're referencing a particular book chapter, then it's a bit different because you have to write the publishers, editors. So depending upon what you are referencing, you can reference a website also, you can give a reference of a video also if it is relevant for your study or your thesis. So as per ICMG criteria, and there are abbreviations of journals that are being used. So we have to be careful that in the abbreviations, we don't form our own abbreviations. It is given by National Library of Medicine. We follow those abbreviations that are given there. Otherwise, we go to the website of that journal and we check what abbreviation they are using. if you don't find, there are certain journals which are not indexed in PubMed, so you will not get the abbreviation in National Library of Medicine (NLM) or PubMed. So what you have to do in that case, you'll see the check the journal website. Even suppose you don't find in the journal website what is the abbreviation, then you have to write the full name of the journal. It is better to do that, and follow a uniform pattern throughout the referencing, because often we see comments on references. So this is a particular place where you have to take some great care. And the references should be in the order of appearance in the thesis. It should not be as per, it is not in alphabetical order. It is as per the, how it is, though the first study that you have referenced, maybe in introduction somewhere, that will be one. So in references also that will be one. And then when you go to methodology, maybe you are reaching after introduction, you have finished. In introduction, you have written 12 references, cited 12 references. Then you go to methodology, then you'll start with 13th. And then you come to discussion section. In results, you don't have any references. Results is all your own finding that you are showing. So in results, you will not have any references. In discussion, you will write references again. So if the methodology section, you are ending the references at maybe 30 or maybe 20, then in the discussion section, you will start references from 21 and then go on writing the further references. So after this, lastly, ethical considerations are important. First is the institutional ethics committee approval must be there. Second is plagiarism is not to be done. That is, copy pasting is not to be done. Even if you give reference, even if you cite that other paper, you can't copy paste, or you can't copy paste with giving references. You'll have to paraphrase. You'll have to write it in your own words. So plagiarism is not allowed. Data fabrication, data falsification also. These are unethical, unprofessional, unscientific things, and even at times there are punishments for certain things. And nowadays also we every now and then we find many tall figures in science and in various other domains where they fall later on in their careers because of plagiarism, data fabrication, data falsification charges. We have to take permission from the patients also. The forms that we have to get it filled, a consent form for adults, and if they're children, then maybe assent forms will be required for those who are doing research in pediatrics. So these particular things, as per the guidelines of the institute, you will have to follow. And ICMR guidelines are basically the main guidelines in ethics. There is a document also, you can see that from there. This is the article that was in public domain, the abstract. So I used this because this session is with the Orthopaedics Society, and those who will be attending are belonging to orthopedics background. So I thought I will give some example from this particular domain. And Dr. A.K. Jain is one of the authors, so I took the liberty of using this particular article.
Thank you very much, sir.
Yeah, my acknowledgements to all these my gurus, without whom it would not have been possible for me to learn and come here and interact with you all. So,
okay, yeah. Thank you very much, Professor Khan. I think that was very useful, and certainly I think the students should take note of the various points that were brought up and plan their thesis and write it accordingly. I'm sure they have some questions, so we'll open it for questions from the DNB students and the MS PG students.
Yeah. DNBs, if you have a question, you please ask directly. And meanwhile, sir, I'll just want to know, when you are discussing about the references, that about the Vancouver and all you have to, when we search for PubMed, sir, there is one option of format in the citation. So in that one, there are few things written, like, as you mentioned, one is NLM, that one, then AMA, APA, MLA. If we can take directly from there, sir, is it possible that any one of these is we can take, or?
NLM criteria is very near to ICMJ criteria. So we can directly use NLM criteria. But again, if you take some references from PubMed, and if you take some references from some other website, not PubMed directly, what will happen? There might be some differences, even though both will be broadly following Vancouver criteria, but still there might be some differences. Okay, so in order to avoid that, it is better we copy paste. Nowadays we do that, we copy paste the references, but then we should be careful that we see that all the references that we are doing, they should be uniform. I will tell you one simple example. For example, the reference that you saw here in with the slide that I showed you when I showed the last slide where I was showing the reference of the article that I was using the abstract from. In that, after each name of the authors, like Jain, then it was dot, then A dot and K dot. If you look at the reference in other places, you will just have Jain, A, K together and then a comma. Now these small things matter when you are seeing the references. So we get to know that different, just copy pasting has been done. That is not correct. Whatever pattern is followed, whether if you want to put a dot after A and after K, then you will have to put it for other authors, for other references also. So these are certain things that need to be, sometimes capital letters mein title hota hai, it is like that. Then we have to see other articles, it is not like that. So that is the uniformity is to be maintained, even though broadly they all follow the same pattern. Thank you, Janki.
I think there's a particular format which you like. You have the author's name, the article, etc. But it should be in the same form. You can't have suddenly one in capitals, the next one in small letters, the third one in mixed. They should all be in a particular format when you put it into your paper. Okay, so it's not necessary that it has to be one particular format, but whichever format it is, you should have it uniformly through your references.
So one more doubt which usually the DNB used to have, that where to put the number, like just after the author, like when we are writing the review of literature in the thesis, is it just after the author or at the end of the sentence? Which one and when to put that? Because
yes, this is a very good question. Actually, this confusion is there. Again, first thing is uniformity. That if you are using a superscript at the end of the sentence, then use a superscript throughout. If you are using a superscript in square brackets, that is also correct, use it throughout. The first thing is that what is needed is it should be in a numerical format. It should be numbers only. That is the main criteria. Now, if you are not using a superscript, just writing maybe 2, then you put it in bracket, whether it is curved parenthesis or whether it is square parenthesis, square brackets. But it should be uniform. So you write a number, put it in some brackets or parenthesis, and follow the same pattern throughout. Usually that comes after the full stop. But nowadays, I am seeing in some journals, I will say, thesis, it follows university pattern, what the university follows. But in some journals, I am seeing that now they have done is that they are writing the number before the full stop. So that is a journal requirement. Journals may say that you write in superscript, you can write in you just write it 2 and then don't write it in superscript, put a curved brackets in that. So it will depend upon that. But main thing is that it should be, citation should be in a number format, and whatever you follow, whether superscript or no superscript, it should be uniform throughout the thesis. And in our thesis, mostly we write it after the full stop.
So one more doubt, sir, about the tense. Like when we are writing the methodology and result, in which tense it should be?
Yes, usually we see that in thesis, methodology section is written in future tense. We will do this, we will do that. And that is because sometimes the student copy paste the protocol methodology and writes it in the thesis. So it is important that this is focused on, and the student changes the tenses, because thesis means you have already done the methodology that was to be used. So it should mention that we have used this, we did this, we collected the data from this. So rather than we will collect from this, that in protocol, you write all these things in the future tense because you have to do your study in future. But when you are writing thesis, you have already done the study. So it should be in past tense. Yeah, thank you. Thank you, Janki, for that point.
And so is there any difference between abstract and study performer, what the DNB candidates are used to send to NB? Is that almost same, the abstract and the performer? Or the protocol?
I think you are referring to the protocol that is sent at the beginning, right?
Yes, sir.
Yes, yes. So there is a difference. There's a big difference because that is at the protocol writing stage when you are making the proforma. So in the protocol or in the proforma, you just have the title, you have the introduction, you have the review of literature, that is a detailed thing, what all things you have read about that topic, and then you summarize it and write it in the introduction also. And then you write the methodology and then you give the references. After aim and objectives, you write the methodology and you write the references. That is all what goes in the protocol in the beginning. But in thesis, you have add-on things like results and discussion and conclusion and recommendation. All these things are add-on in the thesis. Summary or abstract is at the end we write, that consists of all the things from title, introduction in short, methods in short, results in short, discussion in short, and conclusion in short. That is kind of abstract. So I will say summary of a thesis is like an abstract. Protocol is the initial protocol that you're submitting, what will you be doing, and it ends at methodology only. After that, you don't have, just you have references, that's all. Other than that, you have ethics committee forms and the questionnaires in Hindi and English or some local language, all the consent form, all these things you attach in the protocol when you are submitting your thesis.
Yeah, so at that time when you send your proforma or your protocol, you haven't done the study. So you don't know how many, you have planned to do so many cases, but you may have 2 more or 2 less or 5 more, or depending on that. So when you're doing abstract, it is after your study has been, so it has to include the number of cases that was actually there. It depends on what all the other factors you want to put in, like age, sex, etc. Then you do your, so it's a brief summary of all the steps of your actual paper. Okay, so every step has to be put in there, including the results and conclusion. Yeah.
There are a few questions in the chat box. Dr. Avinash want to know that many times it's very difficult to formulate clear research question and lacunae in literature. So how to proceed with that?
Yes. Now, when a student joins a particular course in orthopedics, post-graduation in orthopedics, or maybe other subject, what happens is that we have been, during our MBBS times, we know what is the management, what is the guideline, we are learning that. And suddenly we are told we have to find a lacuna. Now that might be difficult at that stage, and it is difficult at that stage. But our seniors help that at that moment. That is where we can discuss with our faculty, with our seniors, with our supervisors, co-supervisors, that what is because they are doing the orthopedics practice for so many years, and they know where are the challenges that have to be addressed in the practice. And if this discussion happens, they will come to know. So it is very important that rather than just searching on the website, that we find that when they are asked to go and search for a research question, the student will go to the website, Google, and they will start searching research question. They will start reading journals, and mainly the international journals, study published in Japan, USA, Germany. It's fine, but that question might not be relevant to India, might not be relevant to a particular state. We have to find out our own problems, our own research questions, and then try to scientifically find an answer to that. So our seniors, I think, should be those who are working in that field, must be the first point of contact. And if we try to discuss and gain some knowledge from them, it helps us a lot. And then we see the studies, what have been done, how it is measured, what can be done, what type of studies can be done in this particular component. So Avinash, I would like to say that you discuss with your seniors, with your faculty, with those who are doing this particular orthopedics practice in the particular topic since a long time. They will be able to tell you very easily what are the challenges. It might be difficult for you. And obviously you look at some journals and you find out India studies published from India. And some review of literature also you can see related to that topic, because review of literature or systematic reviews, they consolidate the findings, what have been done on that topic and what is the lacuna. So you can start searching a review of literature on that topic published in some journal in India. So I think that will be helpful.
And the research question would depend on, suppose you're studying the treatment of some fracture. So you're looking at what the results are. So that's going to be one. Then if you want to compare it with something else, then you need to compare it with some other method and talk about. So those will be the questions that you have to answer in your paper. Okay. And lacuna would be the problems and difficulties that you might have during your study. Either you may have cases which don't fit into what you're trying to say or whatever. So you have to plan it. You have to put that into the initial performer and also at the end of your final study. Yeah? So if there's any strengths and weaknesses of the study, okay, so if you have more than the normal number of cases, that could be a strength. For some reason, you haven't been able to get enough cases, that could be a weakness. So things like that you have to look at and put that into the paper.
So, like a few of the thesis has used to write the limitation of the study. If we want to include limitation.
So that's weakness or limitation to come to.
Okay, sir. So in result, we can put it, no, sir? That result section or discussion?
I think it comes into the discussion.
Last part of discussion will be the limitations. In our thesis, like in Delhi University, we have this particular guideline where after discussion, we write a separate page on limitation. But in certain universities, in discussion only, you write the limitations at the end. The last paragraph is the limitation.
So one more question from Narayan. That should we start introduction with epidemiology or with definition?
Introduction, it is better we start with epidemiology. When I say epidemiology, I will like to further refine it and say that burden of that particular problem. Because if you write in one sentence that what is the burden of the problem, which age group is suffering more if you are doing a study in that age group. So if you write the age distribution or in certain locality, in certain area, suppose there are certain orthopedic problems that is prevalent in your state or your district, where your medical college is there or hospital is there. So you can write that this particular area has got this prevalence of this is higher and this is what the studies have reported. So you start with epidemiology, mainly burden, which age groups are affected, which geographical location, people from which geographical areas are affected, what are the probable risk factors. So you can focus on that. And then definitions, usually we don't write in introduction. Definitions you write in the methodology section, what definitions you will be using for various terminologies that you can write in your this section rather than writing it in introduction. Introduction, you just try to answer why this study is important. Some definitions may come. Nothing is sacrosanct, like it's not a hard and fast rule in this particular part. Some definitions, if it is important, I will give you an example. One study that we are doing is on workplace breastfeeding support. Now, this particular terminology is a relatively new terminology, I will say. So we wrote that definition in the introduction somewhere after the half of the introduction ended. Then we wrote this particular point that workplace breastfeeding support has been defined as this by so and so organization. So because it was a new topic, we thought in the introduction people would like to know the background, what this actually means, this term actually means. So you can write, but when you start with, if you directly start with the introduction definition, it seems very boring to read actually, and doesn't help with the content and why we are doing the study. We are not doing a study because of the definition. We are doing the study because of the burden of the problem. That should be highlighted first. Thank you, Narayan.
So the last question,
I think that,
yeah,
okay.
just
One more thing.
So, just one question about this one, sir. That few of the thesis they used to write the recommendation also, and few of them in on conclusion. Like when we used to write for DNB, it was with the recommendation, and even for our first batch DNB in Paris, they used to write the recommendation, and other like the recent thesis what we used to see, there is no recommendation is written in that, but both were accepted for DNB. What is your thing, sir, that we should write the recommendation at last, or with end with the conclusion only?
Yes, I think it's a good practice. It's a good practice to write that based on your findings, what do you recommend, what do you suggest? I think it's a good practice that one or two suggestions from your study, what is coming out, you can also give suggestions about what future studies should focus on, what you are not able to do in this study. That also can go as a part of the suggestion. If you think that certain particular component is better, then you can say that this can be tried to more studies can be done to find out further validity, or you're already proving a point that has already been proven. So you can say that now this practice should be advocated amongst the policymakers, or guidelines should be framed around this particular novel technique that we have studied. So it is better that we write a recommendation section at the end of the thesis. It's good to read a thesis which ends with some recommendation, but the recommendation should not say something which has not been done in the study. I see often people writing introduction recommendation about something that is not in their study, but they will give so many recommendations. It should be this, it should be that should be done as a, and people should be counseled about this disease, people should be trained about, there should be training even about this disease and this technique. If you have not done all these things, don't write in that recommendation. Recommendation should be very focused, emanating from the findings of your study, not all the other things that are there.
And so you have mentioned about the sample size, there are some formula. So those are available on the internet, sir. So
everything is available on the internet. I will say we don't use formulas now, and statisticians also, I don't think they use formulas now. Everyone is using softwares in the background, they use formulas. But even we should know how to use those softwares, what information is needed for a particular type of study. So in that you can use certain softwares like EpiInfo.
Okay, sir.
I will just write in that chat box like EpiInfo. So this is a free software you can download, and it gives you sample size calculation for cohort studies, case control studies, comparative studies, prevalence studies. And there are other softwares also that can be used for sample size. One study is called as G-Power software. So when you want to compare means and all these things, you can use this software. So they are free software, easy to use, implement. So this can be used. Formulas, I don't think these softwares also give you what formulas they have used, what references they have used. So you can cite quote that also in your thesis if you want.
So thank you very much, sir. Probably the internet connection was weak for this, so I think sir has disconnected just now because of that voice is also.
Yes, he was not able to see the video also, I think.
Yeah, in between, so yes, sir. So I think it is very useful, sir, even for us, not only for the postgraduate. So I think what most of the thing we have covered, and whatever the questions we used to discuss, and the few things when we can plan it, like few classes on statistics, which is one of the very difficult topic for the methodology and a result, these two things if separately in the future, if you have time. Sir is just now joining right now, so I think,
Yes, sir.
yeah.
For various topics, there are actually all these topics we conduct like 2-hour session, 1-hour session for each of these, introduction, then other parts also, so that we can think of later.
Yeah, thank you, sir. So,
Great. Thank you very much, Professor Khan. I think that was really very useful. Thank you very much for taking out your valuable time to talk to us. And hopefully we'll have you again sometime in the future. So, I think the MB and the MS students should have gained a lot from this, from the deliberations today. Thank you very much.
thank you so much.
Thank you, Janki, for coordinating.
Sorry about that slight internet
Yes, sir.
problem
Yes.
in between. Okay.
Yeah.
Lost connection. Okay, bye.
Yeah. Thank you, sir. Thank you so much, sir.
Thank you, sir.
Thank you, sir.